All right, good afternoon, everybody. Welcome to the third episode of our SpineZone webinars, really welcoming all of our group coming from different areas. Today, we don't have Dr. Keon here because his wife had a baby a few weeks ago. So Xander
So exciting.
is so exciting, isn't
Yeah.
it? Xander is the new baby. And so let's say hi to Xander. Hello,
Hey,
Xander. This is
Xander.
for you, baby. So today, filling Keon's shoes is Lisa, our Director of Clinical Operations, who is a very, very well-trained physical therapist with a lot of experience. So thank you and welcome.
Yeah, no problem. Super excited to be here and get to talk about some really interesting topics today.
Yes, especially this topic, which is one that is very vexing, right? Because we've been through, all the physiology lessons where everything is like, this happens, then this chemical reaction. The mind and the body are kind of one of those things that's a little bit a little more nebulous.
It totally is. And it's something that, going through physical therapy school, we didn't really touch on much. It was always very this is mechanical cause of pain. This is how you fix it. I didn't learn, well, the brain can lay down some pain pathways, but past that, there wasn't much on mind-body connection at all. And I really wish there was, because it's incredibly prevalent in especially chronic pain patients.
Absolutely. And it's actually such a vital part of everything. Surgery is the same thing. We were so, well, there's something you see on the X-ray or MRI, but this whole person who's behind that is so important, because that's the person who's got the pain. That's the person who feels it.
Yeah.
So in this chapter, I discussed a lot of my own personal experiences also with mind body, which I thought I was kind of somewhat immune to this stuff, right? I mean, I thought, I'm immune to it, but I found that I actually, my mind can play havoc with me.
Yeah, no one's immune to it. Even if you have training to understand that this isn't what's going on with your body, it still can creep up on you because of all these subconscious pathways. And you're going to talk about that more too. It's incredible.
So let's dive into it now with first going into kind of how, when we train, how everything we thought about the brain, at least when I was training, was that the brain is a organ that once it develops, it doesn't really change a lot, like a muscle or like skin that can reform. We always thought, nervous tissue, once it's damaged, it's damaged. It doesn't make new connections. But that's not what you learned, right?
That's not what I learned. I learned that the brain is essentially like another muscle, right? It can be very pliable and moldable, and we have to train it, right?
Exactly. So let's talk about the three main principles that underlie this talk today, which is number one is that the brain is highly plastic, and that you can form new connections, and that you can form also connections that are volitional. You can make these connections by wishing to do it and by repeating it, by habits. And what they say is that neurons that fire together wire together.
Right.
Yeah. So that's the plastic portion, but then also the brain, the way it processes is very different than, let's say, an electrical circuit in the house. In that when something comes in through the electrical circuits of the nerve, it can actually then be processed in multiple areas of the brain.
Right.
So it interprets it in so it's a distributed function.
Yeah, and then you're going to talk about this a little bit later too, but in chronic pain patients, instead of it getting interpreted in the correct parts of the brain, it's like a cascade of events that happen, and now we have too many parts of the brain lighting up and causing a heightened sense of pain.
Exactly. And if we don't understand this distributed condition, then we can't really affect it as well as we can. So that's really important. And the other thing that I found fascinating over the years is the body is amazingly adept at keeping score. It actually records things that you may not think it records. You may think you're past this. This thing happened 10 years ago. But guess, you've seen it happen multiple times, right? Where something happens, you have a smell, you have a certain instance that immediately takes you back, and you react like you were 10 years ago at that same period. Right?
Yeah, and sometimes you can't even associate it with the smell until someone brings that awareness to you.
Right. And sometimes it's just a sensation in the body. You feel something, you feel all of a sudden angry.
Right.
So this body, and we'll talk about that a little bit more about how the body keeps score. So let's go first then to the the kind of the wiring that we talked about first. What happens when we feel pain? So in the body, you have this nociceptor, what we call the nociceptor, which is a pain, which is like a pain sensor. And this sensor feels the pain, and the pain rolls up into the nerves, into the spinal cord, and runs all the way up to the brain, to an area called the thalamus. That's kind of the relay station. And then it's distributed through the brain. But it's not that simple. It's actually, let's go to the next slide. It's actually much more complex because the brain has an influence on that. So as this pain comes into the spinal cord, your brain actually has this influence, which you see here in this green arrow, is the brain has an influence to actually either increase or decrease the feeling that. Oh, now, isn't that amazing?
It is amazing.
Brain, like, has this, and actually these inhibitory factors are very, very strong.
So this is really interesting. So what you're telling me is, like, if we look at this slide back here, where it looks like a simple track of, I perceive pain, it goes straight up to my brain makes this decision, and it tells me what to do. But when we think about it, it comes into play. We have different ways our brain processes, like you're just saying. A simple reflex, like I may put my foot on a Lego, step on a Lego. Right. I pull my foot off really fast.
Right.
But that's different than me having a constant sustained pressure causing chronic pain, always firing those signals, right?
And even when you take that pressure off, it still can hurt because your brain is sensitized. So these are the things we'll talk about a little bit further. And so to discuss this more, we got to understand these different parts of the brain, and think of these as different, almost as different, personify these as different entities within you. You have the reptilian brain, which is kind of the one that's developed early on and it's the least developed portion of our brain, but it's very, very, very important. It's the brainstem, the hippocampus, this portion we have in yellow and tan here. And this portion of the brain is involved with the basic functions of life, breathing and digestive function and other kind of basic functions of the body. And then you have the mammalian brain, which is shown here in green. Now, this is the seat of all of our emotion. This is the portion that keeps us safe. This is the portion that looks out in the environment and says, you know what? Do I need to react to this, or can I be relaxed? This is not an area that you consciously know of a lot.
So it's an area of the brain that essentially perceives a threat.
Exactly.
Potentially.
Exactly. Yes. And this area, one of the main areas here is the amygdala, and we'll talk about the amygdala a little bit further. And then there is the neocortex that's shown here in blue, and that's the most advanced portion of our brain. But interestingly, it only constitutes 30% of our brain.
Oh, wow.
Isn't that amazing? You would think that your thinking brain as a human, that's like 80% of your brain, right? But no, only 30%.
Wow. So a lot of this is happening subconsciously.
Exactly. Under the
Incredible.
layer. And you got to understand these portions to really be able to know how to affect pain and chronic pain very well. So now let's go into a little bit more mechanics of what happens, Lisa. And this is and some of these diagrams I think will hopefully illustrate in a very functional way what happens in the brain. So you have this impulse that comes in from the spinal cord. This is this rising red that comes into this relay station that we call the thalamus. Think of the thalamus and this relay station as the kitchen. Like, this is where the cooks are. This is where all the spices and all the different ingredients come in to make the soup of your life, right? This is all the impulses we get inside. And then this impulse is distributed throughout the brain. It goes to the somatosensory cortex. It goes to higher areas of functioning. One of the areas it goes to is a prefrontal cortex, also called the watchtower. You see this up top here. This is our thinking function that sits up top and says, oh, this is what's going on. Let me think about this and react.
And that's the part that you mentioned only functions about 30% of the time.
Yes, this is the one that, it's not that it functions 30%, it's more that it constitutes only 30% of the brain.
Correct.
Yeah, so we can use it more or less. It's like you said earlier, it's like the muscle. The more you use it, the bigger it gets.
Right.
But look what happens now with this function. It can actually return signals back to your body that inhibit pain. But look what happens in chronic pain. That poor watchtower is small. It's atrophy.
Oh, so I've lost my muscle.
Exactly. You haven't used it. You haven't used that higher level function to tell yourself, you know what, this, for example, in patients with chronic pain, we see this all the time. You see it in the therapy realm. I see it in the office, in the surgery patients a lot, where your MRI and all the diagnostic studies we see don't show anything. Yet the patient is in chronic bad pain, and they mean it. They feel it.
They feel it. It's true pain for them.
Their body's hyper, their neurologic system is ramped up. They're so pumped up that and this area is not working very well. And that, what this does is this area is now not working, and it's kind of short-circuited to, let's call this area the smoke detector.
Okay.
This is an area that is, like we talked about earlier, the limbic system or the amygdala. This is the smoke alarm that tells you, or the fire alarm that tells you, I'm in danger. So these patients actually feel like there's a threat, even though there isn't.
Yeah. So
can you imagine constantly feeling like there's a threat?
That's constantly living kind of like on that red line, right?
Right. So what does that do? It fires all the body to ramp up. Adrenaline, cortisol, all these things start pumping in because you're in a hyper alert state. So this is a diagram now showing both of these sides. So you have this relay station. Again, think of this as the kitchen.
Right.
And the kitchen is getting all these impulses in, and it can either go the high road or the low road.
Right.
The high road is shown on the left.
So getting into that watchtower.
Exactly. It's shown in this squiggly line, this green, and you see it's slower. Thinking takes time.
Yeah, it's a process.
It's a process, right?
It's a process, and you want it to take time.
Right, because you have to contemplate, you have to reason.
Yeah.
All this stuff takes time. So this is the high road of where things can go. But it can also go the right road, which is the reactionary road. This is not necessarily saying that emotions are bad, but emotions are automatic. They're not, and sometimes when they go awry, you want to be able to change them. And that's the problem with them, is because you can't so easily change this side. This is an automatic reflex that then, as we talk about, gets wired. And when it's wired like this, it's so automatic that then these chronic patients, they have no control of their lives.
Yeah, they don't even know that that's happening, essentially.
Right. So they're constantly on fire. Their body's telling them, I'm in danger. I'm in danger. So Lisa, let's say, so now having this basic kind of understanding of what goes on with impulses as they come from the brain and as they're coming to our relay station,
right,
which is that thalamus area, and then now they're going to the brain. Well, let's say you're in distress or you have something that doesn't feel right. What do you do? Usually
I seek out support from people around me.
Right.
Family, friends, someone that I can trust that could maybe help me with the situation, right?
Right, exactly. So you're going to look for your social interactions. Now what? So you go to your friends, they blow you off. They're not really very receptive, and you get a feeling like you're isolated.
Right.
What's going to be one's natural reaction?
I'd probably become more anxious, trying to control it myself, end up in this fight or flight stage that, I got to take control. Heart rate will go up. I'll start breathing heavier, just trying to figure out what I need to do next to essentially survive off the issue.
You're on your own.
Right.
You're feeling like, man, I better fight for myself.
Right.
So now take yourself in that situation and say, this happens chronically and you have no way to express it. You keep banging your head against walls and everything else, but you're essentially like in solitary confinement. Nothing happens. Yeah. What do you do?
Well, over time, your body can't sustain being in constant fight or flight, right? So I assume that my body would eventually start shutting down different things to try to conserve itself. But at the same time, it just shuts down.
It shuts down. This is really bad area too, because now it's like it's closing off. It's completely closing off. Everything shuts down. Body starts to shut down and go inward.
Right.
That is not a good situation to be in. So you see how we deal with things also deals with these three brain functions, right? The highest function we do first, which is go to our friends and our fun. That's our social and that's our higher functioning brain. But then we go to our mammalian brain, which is that fight response.
Right.
And then we go to our lowest reptilian brain, which is conserve, keep it inside. Well, this pattern, if we understand this, is very interesting because patients who've had a lot of trauma, a lot of times they can't speak about it.
That's true.
So this one function is gone almost.
Yeah.
So that's why they need to get to this other level. And that's why it's very, very important that we realize that we have these different sections in us.
Correct.
So let's go back to our slides here on the next level of thinking about this. So we're talking about the 3 levels of safety. We talked about the one on the left being the higher functioning social side, the one in the middle being the fight or flight, and then just the really, really shut down being stuck version. This is the key to all this, is that what you do and the way in which you respond to these and the way in which you've responded to this in the past is recorded by your body.
Right.
Things that you've done even as a child, even adolescent and younger, even in age 2, 3, 4, and the way you were cared for, the way things happened to you and emotional reactions that people have had, sometimes are carried and instilled in the body. Those traumas come out in different times if they're not resolved. If you've reacted to them at a certain time in your life, it's made a mark. And I talk about in the book going through and realizing that these bodily sensations, when I went to this course called Vipassana in Northern California, where you go and you just focus on your body for 10 days, it's amazing how I would go and scan portions of my body and I'd reach a certain area, all this, like I would have vivid images of things in the past and situations and emotions in the past that would happen to me just from scanning a body in a certain location. So I really think this is true on an experiential, meaning I experienced it, but also in the literature, this is what is shown. So this is very, very fascinating to me. So, these elevated stress hormones and denial and being stuck all get recorded in our system. And this is why we put this as a separate slide, is because our emotional and rational brains, when they are in conflict, this tug of war goes right to your body. How many times have you seen patients who come to see you have gastroenteritis, ulcers?
Oh, a ton of different little comorbidities that are happening, that just a heightened sense of inflammatory process in their body from something happening.
Right, exactly. Big. So let's go to how we all deal with this, which is, I think the next question. Before we go there, are there any questions, Lisa, that we have coming from anybody that we should address?
I didn't see any coming through the chat here. So if you guys would like to ask any questions, please make sure to enter them in the chat box, and we'll make sure that we will address them as they come up.
Terrific. So let's go next to what can you do about these functions. So Lisa, how about I just take a little narcotic? It'll dull the pain.
How long do you want to take this narcotic for?
As long as it needs to be, right? I'm in pain. I have pain.
I think the biggest misconception when we look at opioids is a lot of patients will take them for, like what you said, as long as I'm in pain. When in reality, these should only be prescribed for, 2, 3, 4 days at most to get you over that initial onset. And then you need to take more active approach to reducing your pain.
Exactly. So, and the reason so for example, I fell off a ladder, right?
Yeah.
I have very severe pain. I broke my ankle. Can I get opioids?
Oh,
I'm really in bad pain. 9 out of 10 pain.
Can you get opioids?
Yeah, should I
yes. Should you get opioids? Depending on how severe it is. Again, maybe for the first 2 or 3 days, but I wouldn't want you on them any longer than that.
Exactly, because this is what happens. And if you look at the this graph, you see kind of what happens with our pain tolerance over time. Our pain tolerance can be a certain level, let's say when we start taking opioids. And when you take the opioid, your pain tolerance goes way up, right? You can take a lot more pain. But then over time, you see how the pain threshold gets lower, the tolerance gets lower to the point where actually you get to a point where your pain tolerance is less than it was when it started. This is called opioid-induced hyperalgesia.
Oh, okay.
It's a big issue, and it's the exact opposite of what you thought.
So I'm becoming more sensitive to the pain, essentially.
Exactly. At this section, you've now, after falling off that ladder, three months of narcotics. Right. Now, when I go back and do work or do anything else, I am going to feel everything, like my back will hurt, my leg will hurt, my ankle will hurt when I'm walking. Everything starts hurting because now my body's so sensitive because it doesn't have the normal ways that it fought pain before don't work anymore.
And this is scary because a lot of the patients that we get who come to SpineZone are taking multiple narcotics and multiple times a day, I should say, and they're wondering why they're in these high levels of pain because they've been taking it for 4 or 5 years.
Right, exactly. And I hear patients tell me, as I've tried to wean them off medication, but doc, I'm in pain.
Yeah.
Like I'm not trying to, in talking to them, I'm telling you, I'm not trying to take something away from you that you should have, or I'm not negating your pain. I know you feel it.
Yeah.
But I'm telling you, long term, you need to realize that these narcotics are actually detrimental to your long term pain tolerance.
Right. And what's also scary about these, aside from that too, I think CDC put out something that 3 out of 4 prescription overdoses are due to a prescribed opioid or narcotic medication, a painkiller.
Right.
3 out of 4. That's a lot. So there is an epidemic out there about this. So it's our job kind of as clinicians and providers to educate on that and to help reduce that.
Exactly. Very, very good point. So then what else can we do? Well, we can talk about our pain. I mean, I found this to be, can be helpful, right? To have an understanding is very helpful. But I found myself to not be able to make long-term change very easily. Have you found the same thing?
Yeah, I have. And I find that sometimes, depending on how open you are as a person, or even if you are an open person, it's not easy to talk about traumas that happen to us because, again, they're so personal and so deep. We don't want to share that side of us, right?
Yeah, and interestingly, the research shows that in traumatized patients, that portion of your brain is actually shut off. So there's a reason why you can't talk. It's not just you don't feel like it.
So I need someone to pull that out of me.
Yes, exactly.
That's something,
something, or just, sometimes hypnosis helps. Sometimes other types of awareness, techniques can help do that. Because, like we talked about earlier too, our rational brains are not as strong as our emotional brain. As a matter of fact, our emotional brain is thousands to a million times stronger. So when you have a reaction, you probably felt the same thing. When you go and you see that person maybe that you really, deep down, let's say you have a problem with, right? But your mind tells you shouldn't. You go see them, your mind can tell you whatever it wants, but that other side, all of a sudden they say something and you get triggered.
Yeah, your body will react, right? Facial expression, clench of the fist, something, right? So interesting.
Yeah, so that's why I find talk therapy to be good. But the key is that is to deal with the emotional brain also, and to realize that most psychological problems aren't really the defect of understanding, but they're more of a deeper region of the brain that's affected. The thing that you can do the best for yourself in any time of trauma or anything else is to seek relationships.
Right.
Like how good do you feel when you have support and you have love around you?
Oh my gosh, so good. I think about, I go hang out with my family on a Sunday, or I go, I see my girlfriends on a Friday. I feel great for days usually.
Exactly. And that's a beautiful thing. And this is the most powerful protection against feeling traumatized.
Right.
So and this is you need to feel safe at this very visceral, deep level. The other is sleep. I mean, how often during finals or during times of stress, when you don't have sleep, what happens to one's body?
Oh my gosh, your body just starts to kind of degrade and you don't even realize it sometimes when it's happening. You become more irritable, more anxious. You can even become depressed and wonder, why do I feel this way? But it's because I didn't sleep. And when you sleep, that's your body's time to just shut off and to heal and to allow the brain to rest and to grow, allow the muscles of your back to rest and to grow the way they need to.
Exactly. So that's the time for everything to integrate. That's where your brain takes those experiences during the day and starts to wire them.
Right.
And it's an important time and it needs that. Otherwise those wirings get shambled. I mean, it's like, it's like then you get this wire soup instead of actually nicely aligned wires that is in your brain. Right. And you can use very simple things like melatonin, Benadryl, things like that from over the counter that can be very helpful to help sleep, not having to go to higher level drugs like benzodiazepine,
Yeah,
things like that.
definitely. And this is a big one for a lot of the patients we see at SpineZone or anyone dealing with chronic pain. Is one of the first things we want to address is, how do I get you to sleep better? How do I get you to wake up less? How do I get you to fall asleep at night with less pain, wake up with less pain? Because if we can't get quality sleep, we can't heal.
Right.
We can't heal.
Exactly. So then the next thing is exercise. I mean, there's a lot of data on how regular exercise increases our body's endorphin production,
Right.
our body's own pain relieving function, but also decreases all these darn hormones that are very, very toxic to the body. Right. Adrenaline, cortisol, all these that cause you to essentially age sooner, make you prone to things like cancer, heart disease, right. and chronic pain. Exercise is a very key. And what do you generally prescribe for patients as far as like what they should think about general exercise per week?
Oh, general exercise. I mean, I think, one of the basic requirements is 30 minutes of aerobic activity 4 to 5 times a week.
Right. At least.
At least. Right. And the thing is it doesn't need to be anything intense, especially when you're dealing with like bodily injuries to some degree or disease pathology. We just want you to get up and walk around. Because then, again, you're increasing these endorphins and these feel-good chemicals in your body right. that naturally make you feel better. Plus, if you can do that outside if weather's permitting, then you get the sunshine, right. you immediately feel better. And I always, I joke with people all the time. I'm like, some people dread going to work out, right? They dread going because they know it's going to be tough. Right. But after they finish it, how many times do you not dread that anymore and you think, wow, I feel great? It's all the amazing things that our body's allowing us to do.
So realize that these are things all in your power to rewire your brain. Let's go to the next. Actually, let's come back to us for a second. I wanted to talk about one of the other major things that's very helpful in rewiring the brain. Mm-hmm. And this is what we've done in our clinics, and I think you've seen its effect also a lot in the patients, is we're talking about this connection. Now, we talked about the breath a little bit. The other thing that you can do that's very helpful is called expressive writing.
Right.
So you can start writing, and what that does is it kind of puts together all of the functions of the brain and has it be much, much more visceral, like we talked about earlier, where now the mammalian brain's starting to express itself. Have you seen that be effective?
Oh, yeah. I mean, we've done it with quite a few patients in our clinics where before we even start treatment, before we even ask them how they're doing for the day, our patients know to go to our expressive writing little station. They'll write down, usually it's a negative thought about how much pain that they've been in or something that they've maybe catastrophized over. We have them write it down, get it out of their brain, shut it immediately.
Beautiful.
That thought's gone. They're not allowed to think about it the rest of the session. That next 30 minutes is focused solely on positive thinking and reinforcement.
Right. And you just don't focus on the pain. That's a very, very key aspect in the way in which and actually I went to a course recently. I want to give these guys a lot of credit, Hoffman Institute up in Northern California, where we actually took these patterns that we're in, and some of them are, let's say, perfectionism, guilt, or everything that you can think of that are a pattern that you automatically get, let's say anger. And we write them down and we beat this piece of paper on a pillow with just like a wiffle bat, but you get it out of your system. That's what expressive writing does in a really, really good way. And it gets you to and it's amazing the things that come up. Some of the things that come up, I wouldn't even thought were down there.
Right. I might have to go buy a wiffle ball bat. but it's true. And, there are these places now too. I mean, that's one easy way to be able to do it anywhere. Right. But there are places that are becoming more popular where they have like old junky cars and old television sets, and you can go in there and they'll put you in a room with that and you just take a baseball bat to all of that stuff and people come out saying, I feel amazing. Stress is relieved.
Yeah. So put a name to some of these things, some of these patterns that you get into, whether it be I get angry, whether it be that I feel lonely unnecessarily, or I'm needy, I'm high maintenance, all these things. You can just beat it out of the thing. So let's go back to the slides and a couple more hints, a couple more things that we can give you to do on your own that can really, really help this function. And this is to change your default sessions, right? You want your default settings to change if there's any kind of fright or feeling of unwantedness that will get the brain feeling fear and abandonment, and that will increase the stress hormones. Feeling safe and loved with exploration, play, cooperation, that is the change that you want to see. So in this Hoffman process, they talk about this also, where it's key to get awareness of these deeper mammalian functions and to find a way to release, and please forgive yourself. Love yourself.
Right.
We give other people so much more credit, but our internal critic is usually the worst critic.
What makes it so much easier to support someone else, because we hold ourselves to such high expectations, it's harder for us to,
Right.
be our own best critic.
Exactly. So listen to that inner voice, forgive yourself if it sounds too harsh. That will allow you to imprint new patterns.
Right.
So this breath that we talked about earlier, this was the awareness that comes with focusing on the breath. It's both conscious and subconscious. And when you do that, and the key is in this is not reacting. When you have this breath then that you focus on, it focuses your energy so all this mental chatter doesn't go on. And then in this process that I went to Vipassana, you kind of go through the body and let everything express itself, but don't react to it. Be what we call equanimous, meaning like be neutral to whatever comes out. Let it express itself. That lets things not imprint themselves. That stops things from imprinting themselves negatively in your body.
Interesting. So basically what you're saying is there's this kind of interplay, between what our thoughts are doing and our physical state.
Exactly. This is that body keeping score.
Yeah. Interesting.
In sensations. Very, very interesting. So you can change this. And this goes with, movement therapy programs like yoga, Tai Chi, Qigong, and martial arts. These just decrease the firing of that amygdala, that fire alarm. And of course, rhythmic dancing and play and dance and things like this, also very important.
Yeah. And this is really interesting because doesn't our brain work off of brain waves?
Interesting you put that. There's a lot of research now on how your brain does have a frequency that the overall, we call it, and it can be recorded in EEGs, which are electroencephalograms. And what happens is that the outside music can actually, when the brain senses that outside music, it can actually change its frequency to match that in a very harmonic pattern. So almost like a chord, and it matches that outside frequency. And so you can actually directly change your inner state by music. And we know all that, right? You put a nice music that you like, you feel good,
exactly.
It changes your mood.
Well, that's really interesting too. When we think about the brain being pliable and everything like that, there's been studies on patients who have dementia or Alzheimer's. You play music back from an era that they can remember, and all of a sudden they're dancing and singing the words to the song and they just know it, right?
Exactly.
That connection, it's crazy.
So let's go back to us again.
And you guys, I know that there's a few questions that have come through. We'll make sure that we address them before we wrap up.
Yeah, so let's come back to us. So really appreciate your attention. Now we can go to your questions and see if there's anything that folks want more attention.
So I have 3 questions here from Bea Truesdale. Do physicians generally prescribe for a number of days, or in general, are they prescribing a number of pills? Talking about narcotics.
Yes, narcotics. Good question. Very good question. I think doctors do it both ways. A lot of times, you have to, on your signature patent, you have to put the number of pills, and you put on there, take so-and-so number of, number for so-and-so number of days. And it's generally something where, it's best even if you get a longer prescription, because doctors don't want you to have to come back in 2 days or 3 days. Right. But manage it yourself. Stop, realize that, man, I may have more pills. I don't have to take it as frequently, and I got to start tapering after that 2 to 3 days.
Yeah. What's really interesting about this is, someone who's kind of in the medical field or has had someone told them will realize that I'll get a prescription for 30 days of a pain medication. I know I only need to take this as needed, right? And a good example is back in October, I had this minor procedure done and they gave me a prescription for pain medicine. Well, my brother came over, I think 2 days later, and he's like, have you been taking the medicine the doctor gave you? And the doctor did give me another medication that I had to take.
Right.
And I said, yeah. And he goes, well, why is this bottle still full? And it was my narcotic medication.
Oh, okay.
And I told him, I was like, this isn't a prescription, though. It's not like I have to take this daily,
Right.
3 to 4 times a day.
Right.
I just need to take it as needed. He goes, but the doctor prescribed it for you. It says on the bottle you can take it this many times. I'm like, right, but I don't need to.
Exactly.
And that's when the light bulb for me went off, that's not always common understanding, I guess, in a way. So unless it's explained by the pharmacist or by the physician or by whoever's prescribing it, I could see where patients fall into this kind of cascade of taking it like a prescription.
Right. Exactly. Hopefully that answered your question. Yes, you have to monitor these medications aren't like other medications like high blood pressure or everything else that you have to take it as, exactly as directed.
Yeah. Okay. Another question from Mr. Raiszadeh. Interesting. The same symptoms, read, flight, or flight. Do those mimic fibromyalgia?
Interesting.
Or is there a correlation? Maybe?
Yeah, is there a correlation? Fibromyalgia is a very tough disease to get our arms around. There's a lot of research and there's a lot of disputes about what causes it. But a lot of people, first of all, fibromyalgic patients almost always have sleep difficulties.
Oh, definitely.
Almost always. I mean, uniformly.
I think it's like number 1 on the list.
Exactly. So, and if you can fix that, a lot of times the fibromyalgia does get better.
Interesting.
So it is related, I think, especially that any of these chronic pain or what we call even autoimmune disease, a lot of them have a definite mind-body component. I think that's very important that we have to address. So yes, I do feel like those are affected, and your stress hormones are higher in patients with and their pain thresholds are lower.
Yeah, but I mean, think about it. If you have something like fibromyalgia where your body's constantly in this inflammatory process, it's constantly turned on, you're constantly in fight or flight, it totally makes sense. Right,
exactly. Well, hopefully that made sense. So I've had a lot of fibromyalgia patients who really focus on exercise, even though at first they have pain, and sometimes you have to be careful by not doing too much because they can flare them up too much early. So you have to be very graded. But then getting those patients to sleep. Right.
I think it depends on what what exactly PT we're talking about. So sometimes what we'll prescribe as physical therapists is a home exercise program where I'll have you do these basic exercises to engage muscles at a very low intensity or to stretch, and we'll do that 3 times a day, every day of the week. And that's kind of just to bridge the gap when you're not in PT. But generally PT is 2 times a week, 30 minutes, an hour of some kind of therapeutic exercise with rest sets built in. So home exercise program, very low level, get the muscles firing, get them stretched, a little bit of like what we call palliative care to make you feel better. No risk to re-injure yourself. That's okay, 7 times a week, 3 sets a day.
Absolutely,
But more moderate to, challenging exercise, I probably wouldn't recommend 3 sets a day, 7 times a week.
Yeah, like we talked about in the talk too, like, we do want, and the recommendation is to have at least 5 days of exercise at 30 minutes at moderate level, like walking. But when you're going into high intensity exercise, which is very, very important for building strength, that's how we build strength. You have to give yourself a minimum of 2 days to recover.
Right. Definitely. Another really good question from Ms. Truesdale here. This is kind of one of my favorite ones that we get a lot in clinic. Is there truth to exercising through pain? Will making my muscles stronger get rid of pain?
That's a great
no pain, no gain,
no pain,
right?
No gain. Yeah, let's just there is the long and short answer to that question is there is some truth to that. So, for example, if you have a condition because you sat for a long time, let's take a disc condition, right? You have someone who has a bad disc because they've had bad habits for 10 years and they haven't been exercising and they have pain for that. as they start exercising again, they're going to have pain.
Right.
But we try to differentiate in patients.
Right.
Is this pain muscular pain, or is this pain a nerve pain?
Yeah.
Or a pain that's causing tissue damage? We don't want those.
We don't want those. Right. And I think that's the biggest thing is you have to be able to differentiate. Is this soreness, muscle fatigue, or is this the same pain that I came to treatment for? Am I getting more leg symptoms that are driving me nuts? Right. If that's the case, if you're having pain similar to the same symptoms you're feeling before, we shouldn't be doing that exercise and we need to modify it. But if it's general muscle fatigue or post-exercise soreness that's not higher than the levels you came in with, that's okay. To some degree, you need that fatigue, you need that muscle breakdown to regrow muscle.
Right, and we'll talk about this in later webinars, how this high-intensity exercise, even though it's not comfortable, because it's not comfortable to build up muscle. No. But to do that, that's the only way we can build that core muscle to support those structures. And that will eventually decrease pain. It just takes, it's just a harder process, but it's the really long-term fix.
But that's really another important point to kind of note on with the no pain, no gain, is that when you come into therapy initially, there is going to be some soreness, there is going to be some fatigue, because again, you're using muscles that you haven't used and you're working through this injury. But long term, it should get, in a way, easier that you're not experiencing as much fatigue, but you can then increase the level of challenge you have. Mm-hmm. So right away, you don't jump into the deep end and do things that are going to cause a lot of soreness and pain.
Right.
You build up slowly, which is why with our program, we get 6 to 10 weeks to build that muscle and to build that strength. So we can start at a nice, good pace.
Yeah, and you got to realize that, you can't get rid of, something that's been going on for 10 years in 2 weeks.
Yeah, Rome wasn't built in a day.
Exactly.
Right?
And these kind of things, patience is key in building habits. Again, you want to wire your brain also for exercise. You want to buy your brain to want it, to desire it, and to keep giving it that.
Right.
So that's also part of this wiring process.
Right. And I think what's really cool when patients come to SpineZone, like I'll get a patient that I have a valve and they're like, I'm going to have to work out. And I'm like, we're going to do some basic exercises to get you feeling better, right? And they go, well, I don't like working out. This is not my scene. But eventually, too, we know the benefits that we talked about that exercise has on our body, releasing those good endorphins and those good chemicals, right? Usually by week 2 or 3, they're like, I actually like working out and I'm feeling better, right? But again, it's how you introduce those exercises into your program that could be night and day the experience that you have working through these injuries.
Yes, yeah, very good, very, very good point. That's why I'm so happy with sometimes when I see patients that have changed the way they think about exercise, and they think that, man, this is now very different. First I was reluctant because I didn't want to have the pain. Now I'm like a different person. It's, to me, I feel like I'm not only changing their back, I'm changing their outlook on life, their risk of cardiovascular issues, their risk of strokes, all the things that you can decrease with that.
Again, I mean, it always sounds corny and like you hear it all the time, but it's not just a temporary fix. It's a lifestyle change. You have to change your lifestyle, because unfortunately, once you have an injury, most of the time that injury can persist long term if you don't do anything about it. And even when you do go to PT, it's still always going to be a little bit of a work in progress. I think of my shoulder. I hurt my shoulder, training once. And when I do my exercises, I feel great. No pain in the world, full motion, feel awesome. When I stop doing them, I don't feel the immediate effects. I feel effects 2, 3, 4 weeks later, right? What do? I start my program over again. I feel great, right?
Yeah. And that's like me with my neck, and operating. I'm like this a lot. If I do the neck exercises, I feel great. A couple weeks go by, I'm like, why is my neck so stiff? 2, 3 weeks go by, and get back to the exercises, boom.
Yeah.
Ready to go. So it's very, very important. Yes.
Very important.
Any other questions?
Yeah, I don't see any other ones coming through. We have a few more minutes if you guys would like to pipe in a few other ones. Oh, wait, we do. We got another one. Mr. Pearl, what role do external non-physical stresses have on perception of physical and nerve pain?
External non-physical stresses have on perception. Oh my goodness, huge. Non-physical stresses are a huge important. For example, whether it be monetary stress, stress having, stress of the job, stress socially. Let's say, you feel ganged up on.
Right.
These kind of things, all these have a massive effect.
Yeah. So
on pain.
immediately I think back to chapter 3 in your book, where you talk about 2 different kinds of disorders: conversion disorder and somatization disorder, right? Where conversion disorder, we, feel this stress, it manifests in neurological pain, like numbness, tingling, burning. I've experienced that myself going through school. I thought I was having mini strokes because my face would go numb. Turns out I do an MRI, they screen everything, nothing wrong with me.
Right.
Doctor goes, we need to figure out what's happening. I realized every time I took an exam, like half my face would go numb because I was so stressed, right? Conversion disorder. The other one, the somatization disorder, is when, again, we have these external stresses coming in towards us, and our body will manifest that in physical pain.
Exactly. And actually, your question is very apropos, because as a matter of fact, I think those non-physical stresses are oftentimes, even to some degrees, more important to identify, because they're somewhat hidden.
Yeah,
and they're recurrent, and they're very, very impactful in how patients do. So yes, keep an eye on those and try to identify them, because also, like what I learned in the Hoffman process when I was up north, these are hidden. A lot of these you don't know about until, like in that process, we had to contemplate, go back and try to figure these out. When you realize and you link some of your reactions to what happened to you, you realize that your life is a bunch of patterns that keep repeating.
Right.
And these
little triggers, right?
And they've continued to happen since childhood.
Right.
This is where you can really make a massive difference.
Right. And we see this in patients quite often, especially chronic pain patients, where I'll do the evaluation. I'll be like, this really sounds like a disc patient, but they're having these unexplained other symptoms that I can't put my finger on exactly what's going on. And then I start talking to them more and more, and then the patient opens up more, and all of a sudden I'm starting to hear about financial stresses, marital stresses. And I'm sitting there thinking, okay, now we're on to something. So this is an excellent patient that I may have also do expressive writing.
Expressive writing is a terrific way to start.
Or learn how to meditate. Meditating isn't for everyone. It's kind of a hard thing to do. I know for myself, it's hard for me to quiet my mind. I have a million thoughts always racing, whether it's stressful, non-stressful, million thoughts, right? But guided meditation, I found, works really well, because now I'm focused to listen to someone telling me what to do. And you can reduce that stress.
All these great apps now.
So many apps. Insight, Timer, Headspace, there's a lot.
A ton of them.
There's a ton. Good, great question.
Great. We're at 45 minutes. So I think any other burning questions?
I don't see any other ones coming through.
Well, really appreciate your attention, and hopefully that was helpful. We'd love your comments, and we try to improve this each time we do it. And so your comments are taken to heart every time. So look forward to seeing you at our next scheduled time, which I think is about 3 weeks.
Yeah, about 3 weeks.
Great.
Awesome. Thank you, guys. Have a great day.